and the Safe Parking, Safe Shelter Pilot Program, and Shelter Crisis Ordinance. Take a staff report.
Yeah, thank you, Commissioner, Chairman Bongio, and members of the commission. My name is Michael Richardson, and I'm joined here with tonight with Mary Milner, and she's going to present a PowerPoint for you explaining what we're proposing with this new safe parking emergency shelter ordinance. Mary, take it away, please.
Good evening, commissioners and members of the public. Unfortunately, my camera is not working, but hopefully my screen share will work. So, do we have my screen?
Yes.
Yeah.
Okay, great.
Go ahead.
Can you make it full? Oh, sorry. Can you make it full screen? We're only seeing we're seeing the screen, but with your surrounding PowerPoint.
Okay.
There you go. That's perfect.
Better.
Thank you.
So tonight we want to share our safe parking and safe shelter ordinance. This is part of our 2019 housing element work that we've been doing. This implementation measure commits us to adopting an ordinance or resolution that creates a safe parking pilot program along with later implementation steps. One of the things we learned in examining best practices on this kind of program is that successful programs are almost always a coordinated effort among agencies, community organizations, and neighbors. So that's the approach we took. The program that we have developed was made in coordination with Department of Health and Human Services, other agencies, local service providers, and experts in homeless services, as well as the public. The impetus behind this whole thing is the population of houseless people in Humboldt County. And this is measured by the biannual point in time count. The last one was done in 2019. So this map shows basically on the left, it's the count of people on the night of the point in time count. Those are people that were interviewed. On the right, we have an additional set of people that were not interviewed, but they were observed dwelling in vehicles, RVs, tents, or makeshift shelters. So what the point in time tells us is that about 1,400 people sleep in places that are not made for human habitation on any given night. About one third of those are outside the city limits in unincorporated areas. And almost half sleep in cars, vans, or makeshift shelters. So a little bit about our program, our pilot program. I want to introduce having a little problem with my slides here, sorry. So there are two pilot types that we're introducing here. One is safe parking and one is safe shelter. I want to make clear what those are. Safe parking accommodates vehicles, vans, RVs as determined by the service provider. And just an aside, but the provider is going to be a government agency, a nonprofit, or a religious entity. Safe shelter, on the other hand, uses non-vehicle type shelters, which are individual cabins, tents, sheds, huts, and these would have to meet certain emergency housing building standards. Now, in addition to the 2 pilot types, in order to help and guide the providers who will be running these things, in coordination with DHHS, we've come up with 3 management plans. And what these are is different ways to run the programs. And the reason there are 3 is because their providers will have different amounts of resources, different staff. Some will be grant funded, and obviously they'll have different locations. Some may be in very rural areas, some might be by urban areas. So I'll go into more detail about what those management plans are later. On the bottom of your screen, they're called minimal requirements, the village model, and the low barrier management plan. So before going too much further, I wanted to just quickly go through some pictures, some images, so that to give an understanding of what these things look like in other places. This one's in Santa Barbara. This is a safe parking minimal requirements model. The Santa Barbara operation has been going on for almost 20 years. And when people want to know how to do what the best practices are, this is the organization they go to. In fact, the Santa Barbara New Beginnings has written a best practices manual on how to do safe parking. This is what the ones in Eugene look like. They're called rest stops. They're minimal requirements, which is an overnight shelter. This one's been going on for quite a while too. Here's an Arcata example from 2020. This would qualify as a low barrier navigation center, which I'll define when we get down to the management plans. And here's one in Long Beach that also is a navigation center. The feature of a navigation center is that it has sort of maximum services. There's caseworkers, there would be referrals, lots of on-site services. And these are they're basically service intensive versions of safe parking. Here's a picture of one in Yuba County on the safe shelter side. And then the third model is called the village model. This is very much like transitional housing, but not quite. It's an emergency shelter that takes on some of the aspects of transitional housing. So state law has a fairly hefty presence in regulating emergency shelters. What we are allowed to regulate is this short list here. Basically, we can quantify the maximum number of beds, sufficient parking, waiting in client intake areas, on-site. We can require on-site management, the proximity to other shelters, length of stay, and lighting and security. So the general condition in this same State Housing Law Act requires that any standards that we put in have to be objective, and they have to encourage and facilitate the development of emergency shelters. And as an overlay to this, in a separate piece of legislation, the Housing Accountability Act limits the reasons for which we can deny or make infeasible an emergency shelter. And that would require, there's a list again of reasons that you can deny a project that requires written findings, certain specific written findings. So this is actually my last slide. I seem to have missed a few. if you'll forgive me, I'm going to go backwards a few pages and see if I can find the ones that I've lost. I'm not sure if they got out of order or what. There are a couple of other things I wanted to cover. You know, okay, sorry, late slideshow preparation. I'll just kind of ad lib here. We'll go to my fun slide and I'll just ad lib. So one other thing I wanted to mention is where these are located. This is a question everybody asks. The program, pilot program that we're presenting tonight does not include proposed sites, but rather it specifies the zones where safe parking and safe shelter are permitted. The safe parking and safe shelter pilot is a type of emergency shelter. So the zones where they're permitted are the same zones where emergency shelter is permitted. And that would be the C1, 2, and 3 zones, commercial zones, light industrial ML, multifamily zone. These are the 5 zones that have been in effect basically for the last 10 years. And yet no emergency shelters have been built in that time. So clearly there are other barriers. Our proposed ordinance proposes to add a couple of other locations for these things. One is MU, mixed use, which will have kind of a minimal effect. But one other, we presented as an alternative in the ordinance, you'll notice alternative 2. It would be, alternative 2 involves allowing churches, existing churches, to have one of these sites on their property outside of the zones named. So that'd be a handful of other possible locations. The one caveat that we put in the alternative is that the existing church must have a verified congregation of 20 persons. And that'll be something for yourselves and the board to consider, that alternative 2. So I'm going to go back a little bit to the management plans and just kind of fill in. So let me just give you a little more detail on what the 3 management plans do. The minimum, well, let me just say first in general that the cost and complexity of these plans increases from left to right on this table in the bottom of the slide. In other words, the lowest cost, simplest ones are the minimal requirements, and the most complicated, most expensive are the low barrier. The reason for 3 plans is we want to maximize the number of possible providers that can do these, and also to reach the outlying areas of the county, which right now have no shelter coverage whatsoever. If you remember the map we looked at back a few slides, you'll notice that the population of houseless people is spread throughout the entire county. It's not all in the populated areas, but as of right now, there are 5 shelters, and only one of them is in the unincorporated area, and that shelter is right next to the city limits of Arcata. So we have essentially no shelter coverage in most of the county. So that's a reason for 3 plans, to catch more people, to bring more people in. So minimal requirements model. So let me just give you a little detail on that. This is an overnight only plan with minimal services. The cost is kept low by less staff because it's only open overnight hours. Regulation is a lot less than in other models. One thing I didn't mention is that besides the land use regulations, there are reams of other regulations from DHHS and other grant funding entities that these shelters have to comply with. And the regulations themselves are actually a barrier to making these things. It makes it more expensive, you need more staff. So the idea of the minimal requirements is to reduce that burden so that there's a better possibility for these things to happen. What we're hoping is, for the minimal requirements, we're hoping that it can be a little easier to stand up than other ones. It should be portable to rural areas, and it can be tailored to available resources. And it would be suitable for small providers. And conceivably, somebody who has 2 to 5 parking spaces might be able to do this relatively easy. So the next in cost and complexity is the village model. We limited this one to 15 vehicles maximum, or 15 individual shelters or vehicles. That again is the provider's choice. It can operate 24 hours with 2 staff on site at all times. And in this model, it depends a lot on the participants are selected if they can participate in the running of the place and be a little more community minded, if they're able to follow that kind of agreement. And so what we've allowed in this one is for participants after training to actually be a part of the staff, a part of the oversight staff. And then the third model, the low barrier model. This is arguably the best model and does the best job of providing services and transitioning people to permanent housing. It's kind of the preferred Cadillac model of shelters. The problem with it is there's a huge expense. There's a lot of regulation and a lot of staff involved. An example of this would be the Arcata House Partnership. And currently they're the only ones that have the resources and the staff to do one of these in Humboldt County. And obviously they can't cover everything. They can't cover all the 1,400 people. I don't think any one shelter is going to be big enough to do that. So yeah, and the characteristics of the low barrier are its service intensive, a little more costly. There's requirements for data collection and monitoring of the participants. There's more active case management of the people that are participating. It also is required to accommodate pets, partners, and possessions of the participants, and follows housing first, harm reduction philosophy. Now those aspects actually are recommended for all the sites. They're one of the things that makes these shelters work. The allowance of pets, partners, and certain possessions. But along with that, obviously comes some site requirements and more money and more staff. So although they're recommended in the other 2 management plans, they're not required. Hopefully that gives you a little idea about what management plans do. Then I want to go back finally to, sorry about the head spinning slide movement. We did find one correction that needs to be made. It's in the Planning Commission resolution after it's in the same file as the staff report. And there's a date, an incorrect date there. It says that on page 7, it says the Planning Commission meeting was on February 3rd, and that needs to be corrected to March 17th, just a note on that. And then a final note, we did get some comments from Department of Environmental Health. They are suggesting some language that helps them coordinate with our department on these things. They would like to have a referral, basically. And we recommend actually that we just take their language and write it into the code. And I do have, I don't know, should I bring that up, Michael, you think, or?
Yeah, well, we can just explain it on the mic. I think what the Division of Environmental Health is suggesting is they are identifying what's involved with an approved sewage disposal system. They provide some background information, and that'll be helpful for our checklists. It doesn't need to be in the ordinance, But then they do have actually an addition to the ordinance. And if I could, if you could stop sharing your screen, Mary, I'll pull up mine.
Sure.
And I can just briefly show the commission what the Division of Environmental Health was suggesting we add to the ordinance. It's under section 61.05.5 under the operating standards. They want to say, they want to add this additional standard that says if the site allows recreational vehicles, that no disposal of sewage from recreational vehicles is permitted at the site unless the provider documents the North Coast Regional Water Quality Control Board has approved the sewage disposal system for that use, and details of the sewage disposal system are included in its management plan. And so that was just kind of a late addition that the Division of Environmental Health is recommending, and we're recommending that as well. So that's the end of our presentation, and we're open for questions, answering questions or comments, and listening to what the public thinks.
All right. Brian, I saw your hand go up first.
The table that you showed several times with the different types of management plan, I was not able to follow your explanation for the bottom row. It said 6 months, and I think manager's discretion. Could you repeat what that meant, please?
Sure. I can bring it up again, or I can just tell you. 6 months is there's a maximum length of stay that we're allowed to set. And actually it's partially set in the emergency shelter definition, in the state's definition of emergency shelter. So it's a 6-month stay for any particular participant in the minimal requirements or the village model management plans. And in the low barrier management plan, because it's a different state created entity, that particular type of shelter does not have a 6-month limit. So because it has really intensive staff, and sometimes they're dealing with things that take longer than 6 months to resolve, basically. So in that one, because it is so heavily regulated, there is no length of stay on there. The provider basically will decide what the length of stay is on that one. Does that make sense?
Yes, it does. Thank you.
All right. Noah? Oh, I'm not sure. Go ahead, Peggy.
So I found that the point in time count is probably seriously undercounting, the extent of the problem, especially in the rural areas. I just wanted to point that out. I know there's a homeless camp behind my house and it wasn't on there. But I have some issues that I wanted to bring up with churches, because a lot of the churches are embedded within residential areas. And so I feel like if you're going to create one of these sites in a residential church area, that there should be adequate public notice and a public hearing and hear the concerns, because I just think that that's important. And if they're going to be in retail areas, I don't know if that's a concern, because I didn't really hear that, but I know in Eureka there was a lot of discussion when they decided to put a site right in downtown Eureka. I think there should be public input and concern. Maybe the community totally supports a site next door to their homes, or their retail business, but I think at least they need to be heard. I would like to see some sites that are exclusive for women and children who are vulnerable. There's often domestic violence, and people need emergency housing, and like today, until they can find something more permanent. And I know in other communities they've created sites that are exclusive to women and children that are fenced in and provide some security to those inhabitants. I also think that if you're going to be in a residential area, there should be some sort of curfew for entering the site unless it's, a supervised emergency entry, where someone comes in, but I don't think people should be able to come in all hours of the night and day if you're in a residential area. A lot of people that are in some of these sites do have substance abuse issues or other issues, and they may not respect the fact that they're in a residential area. So I think these are areas that need to be covered in an ordinance if they're not already in there. I did read through it quickly, but those are some of my concerns. I totally support providing sites for homeless. I've done a lot of studying on this myself and read some of the models that are in the Oregon, Salem area and Seattle, and I think they can be effective, but I think they also have to blend in with the areas where they're staged.
I'd like to answer that through the chair if I could.
Go ahead.
So, the church, the notice and hearing required for a church, that's something we can consider, I think. Also, the pit count being an undercount, that pretty much everyone I talk to concurs on that. And from having done the pit count, that particular pit count, I think also that it was an undercount. So as far as the retail areas, the way state law, there are two reasons why we did this the way we did. And one is that state law limits us on what we can, they require that we designate an area, a zone or zones where these things are principally permitted, which means without the public hearing and comment. However, you will notice if you look in each management plan requires that there be neighborhood outreach and a neighborhood engagement plan, ongoing neighborhood engagement. And just for an example, Arcata House Partnership has I think it's every 6 months, they have a meeting with any stakeholders that want to show up to hear concerns, problems. So that is baked in. It is, rather than being baked in the ordinance, which the state regulations are not going to let us do specifically, and I'll show you why in a minute. We've actually baked a lot of those controls into the management plans. In other words, we ask that the provider lay out exactly what they're going to do, sign on the line, and then they're accountable for that management plan. And they can change it. I mean, they decide, but they have to do it, basically. But I think that is one way that notice of the neighbors would be addressed in this thing. The specific women and children or family versions of these, again, that is going to be something that will be allowed in the management plans. In other words, if a provider said this particular shelter is going to be women and children only, they put that in their management plan, and that's what it is. They set the specifics of how they are going to select their participants. The management plans also have a written agreement with each participant that has, basically the rules set by the provider that they're accountable for. And then as to the idea of a curfew, this is a concern on all these things, site access, who can come in and come out. Again, in the management plan, there are quiet hours. The site access is going to be basically set out by the provider. They'll say, here are the hours of operation, here's the quiet hours. These are the hours where people can come in and out. Here's who can come in and out. And there's on-site staff that's going to be accountable for keeping track of who comes in and out of the site. And again, that's baked into the management plan rather than in the ordinance for the reason, the planning law reason that I showed. So hopefully that
I just have a question
Clarify
about
certain things.
understanding the management. I would understand what a management plan is, but who do they submit this management plan to and who enforces it?
The management plan is on file with the planning. When they get their zoning clearance permit, they have to file, as part of that, the plan is submitted. And it also has to be available in their outreach in a copy at the site so people can see it.
And so then the county then is the compliance officer for this? Okay.
It'll depend. It could be, depends on what the issue is. It could be county, it could be the sheriff,